I am Mohammed Shaheen Ali Dapour. I am assistant lecturer at the Faculty of Pharmacy, Tanta University. I'm going to talk about pharmacy and pharmacist and pharmacy practice in Egypt. My presentation will be outlined in two main points: pharmacy education in Egypt and fields of pharmacy practice in Egypt. Firstly, pharmacy education in Egypt. We have 43 pharmacy schools in Egypt, 22 governmental schools and 21 private schools. What is the difference between governmental and private schools? The difference may be in financial support, because governmental faculties or governmental schools are totally supported by the government, while private schools are not supported. You will pay all the tuition fees. The second point concerning the number of students, governmental schools have large number of students. A large number of students are enrolled in the governmental schools. It may reach thousands of students, while in private school, by law, it's only 200 students per class. The third point is why students will be enrolled in governmental school or in private schools. It depends on your grades in the high school. If your grades is very high, sufficient to be enrolled in the governmental school, so you will enter the governmental school and you will be totally supported by the government. Actually, we have a large number of graduates every year. The last year we have 14,573 pharmacy graduates who are graduated last year. It's a huge number, and we nearly have a 250,000 registered pharmacists up to now in the syndicate of pharmacy, which means that we have one pharmacist for every 400 citizens, and which is 4 times the international average. It's a huge number, or a large number, sufficient for wide variety of citizens. Currently, we have 2 educational systems in Egypt. We have the traditional educational system, Bachelor of Pharmacy, which is 5 years, of education in 8 departments. After graduation, the pharmacist or the graduate will be registered in the syndicate of pharmacy, and after that he will register in the Ministry of Health, and so after that he will be a registered pharmacist with professional license to practice the profession of pharmacy. This traditional educational system without a pre-license examination, but in 2019 a new system have been implemented, which is Bachelor of Pharmacy and PharmD. This system involves 5 years of education and 1 practical year. 1 practical year in hospitals, in community pharmacies, and in pharmaceutical factories. After these 6 years, the graduate will register in the syndicate of pharmacy, and after that he will enter or will take a pre-license examination, which isn't present in the traditional educational system. After that he will register in the Ministry of Health and will be a registered pharmacist with a profession license. During education, each pharmacy school in Egypt have, whether it's governmental or private school, have 8 departments: pharmacognosy, pharmaceutical chemistry, biochemistry, microbiology, pharmaceutical technology, analytical chemistry, pharmacology, and clinical pharmacy. The second point I'd like to talk about is fields of pharmacy practice in Egypt. Most pharmacists in Egypt work in pharmaceutical factories, or as a medical representative, or hospital pharmacist, clinical pharmacist, community pharmacist, academic pharmacist, and research assistant. I'll talk about each point. In pharmacists can work in industrial pharmacy or in pharmaceutical factories. Actually, each factory have three main departments. The first one is research and development. The pharmacist can work in research and development department in developing new products of the factory or new products of the company, and formulate or develop the steps of manufacturing. The mixing will take the time allowed for the mixing step, whether the drying will be wet or drying. These steps or the manufacturing steps will be developed by the research and development department. After these steps will be conducted, these steps will be the manufacturing steps will be conducted by the production line pharmacist, which will execute the manufacturing steps: mixing, drying, packaging, and storage. He is responsible for all for conducting and carrying out these steps. The third main department is quality control and quality assurance, which is responsible for checking the quality of the raw materials before entering the factory, and also checking the quality of the final product. Also, he checks the quality of each step, the quality of the product after each step, after mixing and after drying. The quality control and quality assurance department takes samples of the product or after each step to check whether the manufacturing is appropriate or not. Some pharmaceutical factories have two additional departments, such as pharmacovigilance and regulatory affairs. Pharmacovigilance, which is a post-marketing surveillance. This department is responsible for identifying and evaluating the previously unreported adverse effects. After marketing of your product, the pharmacovigilance department will keep an eye on the product and whether there is a reported new adverse effects or not. The final department is regulatory affairs, which is responsible for registration of the new products. It's responsible for the paperwork and registering the new products in the Ministry of Health. Secondly, some pharmacists in Egypt work as medical representatives who are responsible for marketing of the pharmaceutical products. They are trying to persuade or convince physicians to prescribe their medications and to increase the sales of their company. Thirdly, a large number of pharmacists in Egypt work in hospitals as a hospital pharmacist. Their job may be outlined in four main points. They may work in the Pharmacy and Therapeutic Committee, or B and T Committee. This committee is responsible for overseeing the policies and the procedures in the hospital. They are also responsible for managing the formulary system and which medications will be in the hospital, why they will buy this medication and not this one, and also. The second point may be pharmacists may work as a clinical pharmacokinetics. Actually, in Egypt we have only two units. We have only 2 units of clinical pharmacokinetics in Egypt, in 2 main hospitals. These units are called therapeutic drug monitoring. They are responsible for monitoring the drug level in the blood or in plasma, especially for non-therapeutic index drug. Um, the main and the most common job of pharmacist in Egypt in hospital pharmacy is dispensing of medications, whether dispensing to inpatient or outpatient. Um, Inpatient for patients who are inside the hospital, or outpatient for patients who come for follow-up, especially if they have chronic disease such as cancer patient or hypertension, diabetes, and so on. Also, hospital pharmacists in Egypt can take a role in preparing parenteral solutions, and they may play an important role in total parenteral nutrition. Um, Pharmacists in Egypt can work also as a clinical pharmacist. Actually, we don't have any department of clinical pharmacy in the governmental hospitals, because up till now there is no job description for clinical pharmacists in Egypt. So you will find clinical pharmacy units in private hospitals. There is an increasing number of hospitals which implement clinical pharmacy, and it's promising. The clinical pharmacist will take part in medical rounds with the physician and nurse, and will take the drug histories of the patient upon admission, assess also. He will collect the information from drug histories and from symptoms and signs, and will assess this information and put a therapeutic plan for treating this patient, and monitor this plan, or drug therapy monitoring, to monitor this plan by monitoring parameter, monitoring the adverse effects, or monitor the efficacy of this plan. During implementing this plan, he will do patient counseling and advise the patient about appropriate use of their medication. The large number of pharmacists in Egypt work as a community pharmacist. We have 75,000 community pharmacies in Egypt, which means that we have one community pharmacy for each 1,261 citizens, and which is 3 times international average. Maybe it's the highest number in the world. Each pharmacist is allowed to own a maximum of only 2 pharmacies for each pharmacist, on condition that the pharmacist doesn't work in the government. He's a free pharmacist. This community pharmacy must be managed by a registered pharmacist after 1 year in practice. Up till now in Egypt, we don't have any regulation regarding the chain pharmacists, because there is a dispute between owners of chain pharmacies and the syndicate of pharmacy. Community pharmacists are responsible for, they are supposed to do patient counseling, dispensing medication, and extemporaneous preparation of medication, especially topical preparations, creams and ointments. And also they perform tests to monitor chronic disease such as blood glucose level, blood pressure, and cholesterol monitoring. Actually, in Egypt, the community pharmacist is like the family doctor. He is the first one to be contacted in case of disease, and he, after seeing this problem or this signs or symptoms, he may dispense medication for the patient, or refer the patient to another physician. In Egypt, we have pharmacy assistant or pharmacy technician in the community pharmacist, um, rather than pharmacist in some cases, because of because it's difficult to staff thousands of pharmacists across Egypt with a licensed pharmacist at all times. So you may find pharmacy assistant or a technician rather than a pharmacist in community pharmacies. The huge problem here in Egypt is that there are no clear boundaries between OTC medication and the prescription medications. You can buy any prescription medication even without a prescription. You can buy any type of antibiotics such as vancomycin, imipenem, even without prescription. This is a huge problem and will lead to the emergence of resistant bacteria and to the presence of antibiotic resistance. Some graduates of the School of Pharmacy may work as academic pharmacist or a staff in the School of Pharmacy. Actually, top students, maybe the top 5 or the top 10, have the privilege to work in the faculty or in the School of Pharmacy they are graduated from. This job includes teaching, research, and also administrative work. The progress of their career begin with as a teaching assistant. After getting their master degree, they will be an assistant lecturer, and after getting their PhD degree, they will be promoted to be a lecturer. And after writing 8 research papers, which may take 4 to 5 years, they will be an assistant professor, and the same when they will be from assistant professor to a professor. Clinical research, this is a new field in Egypt. Some pharmacists can work in clinical research companies. We have a multinational private companies such as IQVIA, which is a multinational company that have many branches all over the world. This company is specialized for conducting clinical trials, phase 3 clinical trials for other companies. This is called outsourcing. Outsourcing, which means that this company will do a job for other companies. The main companies make a contract with the clinical research companies such as IQVIA to conduct a clinical trial on behalf of the main company. The clinical research company will register and take a license of this clinical trial from the Ministry of Health, and after conducting the clinical trials, this clinical research company will give the results to the main companies again. We have some pharmacists here in Egypt work in this clinical research company. Actually, owing to the less competitive salary of pharmacists in Egypt and the absence of motivating career pathways, you may find pharmacists work in other professions unrelated to pharmacy education, such as you may find pharmacists work in insurance companies, or work as teachers of biology or chemistry in high schools, or work as translators, medical translators. And actually we have large number of pharmacists travel abroad to other countries and take the exams for getting the license for practicing the pharmacy in these countries. We have a huge number of pharmacists working in Saudi Arabia and the countries of the in Europe or in the United States. Thank you so much for listening.